Streaming now, Dr. Myers.
Good evening and welcome to our final Corona Conversations in the Black and Brown community. It has been a wonderful journey for both myself, Dr. Myers, and Dr. Williams, and we look forward to our final show. We have an esteemed panel of folks that are here to talk about job trends as well as the Great Resignation. As usual, we start off with a brief PowerPoint. Dr. Williams, can you make me co-host, please, so I can share your wonderful presentation? Thank you. I'm so excited, but also sad that this is our final hurrah. It's been a great ride.
Yes, it has been. Likewise. So sad.
All right, so this is our final show. We're talking about employment trends as well as the Great Resignation. As usual, your two guests are myself, Dr. Allison Myers, and my wonderful co-host, all the way from the lovely island of St. Lucia, Dr. Maya Williams. And our latest COVID stats show that there are nearly 50 million total cases of COVID currently in the United States, and it's at a rate of almost 250 per 100,000 in the past 7 days. And unfortunately, we've lost almost 800,000 Americans to COVID. As we know, vaccines have been really important, and we've delivered in this country about 600 million doses, and almost 200.1 million people have been fully vaccinated, and nearly another 50 million have received their booster dose. We know that with Omicron, things have changed. Preliminary data has shown that being vaccinated should help decrease the symptoms from Omicron. That's been shown in a small study out of South Africa, but it's actually recommended that if you have been vaccinated and it's been 6 months, that you probably will do better if you have a booster, because the immunity may wane if you were vaccinated over 6 months ago. Also, we saw that the Biden administration has changed the entry. And for me, who was out of the country, I had to scramble to get my vaccine my testing 1 day before. So for those of us who are vaccinated, you used to be able to get your test and enter back into the country 72 hours in advance. But as of Monday at midnight, it's 1 day in advance. So for those of you who are planning on making international travel, make sure that you can arrange that. Unfortunately, that's not always going to be feasible in some countries. And how has COVID impacted people of color? Well, it's impacted us tremendously. We know that after what's gone on with Ahmaud Arbery, George Floyd, and the list goes on, that there has definitely been a difference in terms of how people of color have been impacted in the workplace. And we know that unfortunately there's been negative treatment of people of color. We know that negative treatment of racial and ethnic minorities, these experiences can lead to fear. And it could be even if you're not affected directly by this. And we know that these increased tensions have been seen in Asian Americans around COVID with such derogatory terms as China virus and the Kung flu. And whether or not it's something that you've heard directly, you obviously have heard it in the media by unfortunately some ignorant people. And this can impact people in the workplace, where it makes people more willing to withdraw in anticipation of the fact that their coworkers may not be kind to them. And of course, unfortunately for our people, we're also disproportionately impacted by the fact that minorities as well as women are more likely to have lower wage jobs, and those who are of the immigrant community are even more vulnerable. So we know this term DEI, also known as diversity, equity, and inclusion, has been thrown around. And there's Dr. Cameron Jones, who does a wonderful talk about thinking about if you get to a restaurant at 10 o'clock at night and it's closed and you're trying to get in, but you can't, you're feeling left out because you want to get in the restaurant, but you can't. There's also this wonderful slide, which shows that in an equal treatment, everyone should be able to stand on the box to see this baseball game, but unfortunately that's not what happens, because even though people are quote unquote getting equal treatment, we know that there's always somebody who's coming up short. If we have real equitable treatment, even though there's differences in height and differences in opportunity, all of us, whether we grew up poor, rich, whatever, we should have the same opportunities so that we can get to where we need to be. But in an even more ironic world, in an ideal world, there wouldn't even be a fence here. We all could watch the game together, whether we're 1 foot 2 feet, 3 feet, 5 feet tall. We all should have these opportunities. But unfortunately, we know that that doesn't happen in this country. And a disproportionate number of people who are executives, senior management, or leadership in general are Caucasian, and generally Caucasian and male, whereas people of color, whether you're Black, Hispanic, or Asian, or Native American, you're less likely to be in these roles in the C-suite or executive leadership positions. And for women, it fares even worse. We can see that as this study, which was done by McKinsey and Company, which is a report of women, it shows that, as mentioned earlier, that when we're looking at the higher ranks, it disproportionately falls upon white men. But even when we look at women, we do see that there's a difference where white women are having these leadership positions far more than women of color. Men of color are not faring much better. And then when we think about the concept of intersectionality, in which is not just gender and race, we think about also sexual orientation. Folks in the LGBTQIA community also deal with discrimination, as well as folks who are in the disability community. Very often, there was an example given in this case of a woman who wanted to go to a leadership training, but guess what? Her wheelchair didn't fit. And so, people with disabilities can also be impacted, and very often we forget about discussing them, as well as people of color and women, as well as our LGBTQI community. But people with disabilities are also often dealing with a lot of these issues in terms of discrimination in the workplace. And we know that in this past year, we've seen the Great Resignation. In the spring of 2021, people were leaving jobs at a rate that was unprecedented. And this term, Great Resignation, was actually termed by Texas A&M psychologist, Dr. Anthony Klutz. And it was that during this time of COVID, people started to realize life is precious, and they realized that they wanted to spend more time with their family members. People were able to work at home, and they realized, I know my value, I know my worth. So you know what? I'm not doing this anymore. And for some folks, it actually was the onset of entrepreneurship that they had been wanting to take a part of, but they had not. In terms of trends, we can see that 40% of people said that in the next 3 to 6 months, they're pretty likely to leave their job. And I actually read an interesting article that instead of doing exit interviews, they actually need to do interviews asking people who stay, why are you staying? So this way you can actually prevent people from getting to the point of wanting to exit your company. And so a lot of the reasons why people are leaving is because they have another offer. And the interesting thing is, in those terms of people who've recently quit, but people who are willing to leave say they would actually leave without having a job in hand. So for employers, it's really important, again, to see what would help keep these people in their jobs, because the attrition rate is definitely going to be high and low. In terms of healthcare, we've seen that burnout, especially on the nurses, but even as well as physicians. A lot of older physicians started to retire and to leave private practices. And most of it was because of burnout. Whether you were on the front lines taking care of COVID patients or not, it was a really difficult time for those of us who were healthcare providers for the past couple of years. On a brighter note, there was expansion of telehealth services. But again, when we're dealing with certain populations, telehealth might not be readily available because in poor communities, they tend not to have Wi-Fi, for example. And amongst our people in healthcare, 28% left companies without another job lined up. And then 37% were looking for better compensation. And so, now there's been the push for diversity and inclusiveness among healthcare leadership. Even in residency training programs, the ACGME has required that residency and fellowship programs do a better job of diversifying. Otherwise, they can actually be in trouble. So unfortunately, all good things come to an end, but on a bright note, we were able to publish this wonderful article called COVID-19 Conversations Within Black and Brown Minority Communities, a Stakeholder and Psychoeducation Approach Using Zoom, Facebook Live. My esteemed co-host was the first author. This is a wonderful thing. And if you're interested, you can go ahead on Google Scholar and find this wonderful article. And we couldn't have done it without you, our wonderful audience. And we would like to thank all of our audience members. We have members from all over the world. We're not just local here in New York City and Long Island. We have people that watch us from Africa, Asia, all over the world. So we love you and thank you. We know that you're not necessarily in our time zone. So we also want to say to some of our former co-workers who unfortunately have left, but they're still a part of the family, Tiffany Harvin and Jody Ann McClegan, as well as Jennifer Polo, who's still a part of the Chayor. We also like to thank Ms. Josephine Guzman at Lenox Hill, who has been amazing. Frank Chaichi, Dr. Anderson Torres, because they helped us when we tried when we did our bilingual show on grief during the holidays last year. And my girl T Dollar Sign, also known as Tanya Fontes, for always posting our flyers. And all of our community-based sponsors. Shout out to Vashti Burke, my soror, who helped us with our first show. Her organization, the Black Educators Committee, as well as A2A Omega Youth Services, Mr. Dwayne Cumberbatch, Dr. Rosa Gill, founder of Life is Precious, Latina Girls Club and Suicide Prevention Program, and of course, my girl Andrea Deloney, my guy Richard LaRochelle, and my other guy Jared Oliveira, who always helped us advertise our programming, and we're always eager to share the word, and they often also watched our shows. And I also, she's not on this slide, but I also have to also give a shout out to Emmeline Kim, who was also one of our big day one supporters and has also always been really good about putting out information about this. So I appreciate you so much, Emmy. And Mr. and Mrs. Robert and Loroni Lomel for their unwavering support, the contribution and scholarship. And last but not least, we'd like to thank all the frontline and essential workers for all their hard work and dedication and service during this unprecedented time and beyond. And if you have any interest in getting in touch, you can always hit my girl, Dr. Maya Williams, at the Division of Health Services Research, Department of Medicine, Chayor, also known as the Center for Health Innovations and Outcomes Research, Northwell Health, 600 Community Drive, 4th floor, Manhasset, New York, USA. Email mwilliam26@northwell.edu. So I want to get into the show, so I won't take too long, but I just wanted to announce our wonderful panel really briefly and I turn the show over to Dr. Williams because they have a lot more to say than I do. So we first up have our Senior Vice President, Chief Purple Officer, of Northwell Health, none other than Maxine Carrington. We also have Mr. Chandler Zhang, MPH MBA, who is our Executive Program Director. He recently just got a promotion. So proud of you, Chandler, for Executive Services at Northwell Health. I see you, sweet is coming your way soon. We also have Dr. Aditi Sachdev. She's a Senior People Research Scientist at Stealth Startup. And last but not least, Kemi Akinsanya Rose, who's a Director at YSC Consulting. Take it away, Dr. Williams.
Thank you, Dr. Myers, for our last presentation. This was very, I think we got an opportunity to find everyone. We couldn't funk every single individual, but so many people helped us and brought us to where we are today. And it's so unfortunate that we have to end the show. Also, Dr. Myers is leaving us and she's going on to something different where she's kind of mixing her passions of diversity and inclusion with also studying diabetes. So we wish her well. Thank you, Dr. Myers, for everything. I couldn't have done this show without Dr. Myers. She was so instrumental in getting us the panelists because her network is so wide. So thank you, and thank you for helping me step out of my comfort zone because I would have never been able to do that. And so now let's get on to the show. So the first question goes to Maxine. So we've been hearing all of this about diversity. Hospitals are losing employees. We saw so many Black doctors for white coats, but still through this all, Northwell Health has still remained one of the best health systems for diversity and inclusion, named by the nation. We were named that by Diversity Inc. and named to Fortune's 100 Best Companies to Work For list. What are some of the DEI initiatives that make Northwell Health one of the top companies in healthcare for diversity, and how has these DEI efforts impacted health equity for patients?
Yeah, thanks so much. First of all, thank you for creating this space. It is incredibly sad that it's over, and I'm hoping we can revive it somehow. But I just want to say kudos to all of you and congratulations on just an amazing job well done. I remember when the series started and just to see what you've done with it over time, it's amazing. I do check them out and I'm grateful to be participating with everyone here and learning. Yeah, so, we always start by saying, or many of us start by saying, yes, we've made these lists. Number one, twice in a year, twice in a row, and other lists. We see them as tests, if you will. It allows us to benchmark ourselves against other organizations, but we always feel like we haven't arrived, right? Because we're not complacent and we're incredibly self-critical. So while we make the list, we're always thinking about what we haven't yet gotten done, what we still need to do. So I just want to give that preamble and set the stage because I don't think we've achieved perfection in any way. And that's from Michael Dowling, myself, and others. We just know there's so much more to do. So let me start by looking, as I look on the screen, I see Ariba and I see Emmy and Allison and you, Dr. Williams and Chandler, and many others from Northwell. It's because of you. The fact that you've created this space, this is because of you. And I can speak to, the numerous programs. So we've made a commitment in terms of increasing representation. And we're doing that at every level of the organization. Removing bias from our hiring processes, and we're doing that. Education. Northwell has been committed to education for so many years in this space. Changing our policies and our practices, language access, right? How do we communicate? Driving an inclusive work culture, all of it. But at the end of the day, our business employee resource groups, and we've got representation here, it's the people who understand the commitment, who are mission focused. And so there's so many systems and policies and programs that we've lifted over the years, supplier diversity, gender diversity, all of this commitment. But it comes down to the people. I can sit in a room and I can think something up and put it on paper, but it's the Chandlers and the Aribas and the Emmys and all of you who go and you drive it every single day and help us spread the message and be ambassadors for it, and also hold us accountable. Right. So we get in rooms on a regular basis with the Chandlers and the Emmys and the Aribas, and they are holding us accountable. But you said we were going to do this. Let's do it together. Right. And so while we are senior leadership and we have the privilege of serving in that regard, these are the team members that, again, keep us accountable, partner with us, and we do it together. And so I just wanted to spread that message. Our work is out there, but it's truly these individuals that are in the session today with us who are really driving a lot of it as well. So kudos and credit to them.
Thank you so much, Maxine. I just want to piggyback about in terms of what you said, and this question is for Kemi. In the summer of 2020, there was an uptick of pledges for organizations to increase the DEIA initiatives. 1 year later, and it seems nothing has changed as organizations are reluctant to address social injustices that transcend society into the workplace. What are organizations DEIA, or I should say, why are organizations DEIA efforts failing or slow to change? And what actions should organizations be taking to ensure that DEIA is embedded in their policies?
Thank you for that question. And thanks, Maxine, for kicking us off. So I would say, the last year has been obviously hard for all of us. When I think about the word failing, the question is, by what standard, or what is our expectation? And so I think a lot of people get into this DEIA work thinking that there might be a silver bullet that is going to change overnight. And my experience is that it's person by person to create that grassroots movement along with the buy-in from the top down. So the two groups of people working together, building off of what Maxine mentioned, this is not one person's job. It's not, and I think a lot of people have thought that, oh, let's go and hire the chief diversity. I was a chief diversity officer, and I felt the burden and the heaviness of that weight on my shoulders as the brown girl, or brown woman, to be really specific. And I resisted the urge to become the chief diversity officer for that exact reason, because I felt it would be a signal to say, oh, Kemi has it. And so my advice, or, you know, when I think about the last year, like what is failing and what is succeeding, I think it's number one, differentiated and contextual, depending on where you are in your journey. And so I underline the word journey because I think that is some people might lose sight of, that this is a journey. It's stair-step changes. You might actually go up the stairs and come back down the stairs because people have also made mistakes. Mistakes look like performative, putting something up on your website, not actually knowing what that means, not knowing what it means in terms of implementation. And employees actually, you know, I've been in situations where my own organization did not understand, you know, what we were putting out from an external communications perspective. And so really my advice in terms of, you know, where to go next around, you know, what actions people should take are really around embedding the practices. I think Maxine mentioned about like what are some of the things that you all have already done within your organization. It's not simple, but it really starts with a lot of our customers here at YSD Consulting, we work with them to do equity and diversity, quote unquote, audits. It's really a scan to understand like what's working and what's not working, who is it working for and who's it not working for. You'd be surprised at how many people you might think, or organizations you think are really far advanced. I'm working with a chief accessibility officer, again, a chief accessibility officer at a very big tech company. And she just did a scan and she was just around how they develop products for the disabled community. And she was just blown away about what she thought was happening versus what was really happening. And so it was an opportunity for her to, you know, pause, do an equity kind of audit and check and really understand, you know, where were the gaps. And that's not a one-time thing. It's, to me, it's an ongoing thing. So going back to, you know, observe, understand what the lay of the land is, doing that equity pause, and then really trying to figure out how to embed it into your organization through policy, process, people. And last of all, it's the repetition. Like I cannot underemphasize, you know, repetition, making sure when leaders wake up and they're crafting their team agendas, when they're thinking of hiring decisions, when they're figuring out how to delegate projects, how do you have equity at the center and diversity at the inclusion in the center, so people have a sense of belonging, that I actually belong at this organization? Because I've seen a lot of companies check the box and get the numbers in terms of representation, and they're like, now what? And if you're only watching the people that are coming into your organization and not understanding what keeps them in the organization, they're going to leave the organization. And that's something that I think people are dealing with right now, is how to retain. They do great numbers, right? The numbers look good. And that's short-term thinking, because if people don't have the sense of belonging, they won't stay.
Yeah, and I think that's such an important thing. I think a lot of people miss out the belonging piece of the conversation. Everybody's about diversity, but nobody talks about inclusion and nobody talks about belonging. And I want to ask this question to Chandler, because oftentimes we see that Asian Americans are often portrayed as the model minority, and people are checking the diversity checkbox, but then Asian Americans are not included in the conversation on diversity and inclusion simply because they're seen as the model minority. But earlier on, Maxine mentioned the business employee resource groups or the books such as Asian Burg, and I know that Chandler is very, very active in this organization or in this book. So Chandler, can you tell us what are books and how do these groups help bolster diversity, equity, and inclusion for minority employees?
Sure, thank you, Maya. And just want to thank you, Maya and Alison, again to inviting me to this kind of great event in here. And so honored to be here with several other great leaders in here. And I just want to say thank you both again for your commitment to doing this show from last year. And this is not your day-to-day job, but this is your volunteering, like this kind of like educational session to the people, not only in US, but also for the whole world in there. There's so many people watching your show. You guys are really popular in some kind of channels in there. So thank you. So and Maya, thank you for the question, because we always being asked or being like labeled as model minority. And firstly, I want to say that this is a kind of like myth right? And this is a kind of like false statement. And so a lot of people were saying that, you know, Asian Americans have this high level education or hardworking. That's true, but there's still Asian Americans come from different channels, come from different background. So some of them came from working visa, some came from students visa, but still we have a lot of people from like different programs, and they come over here to fight for their lives in here, to stay to pursue an American dream, right? So people coming from different levels, and we are labeled as this kind of like model minority, which definitely keep us away from this kind of equity in different ways. So firstly, I want to say that this is a really false statement, and we will try to break this out in there. We are equal to any other diverse and to diverse group or any other groups in there, right? So I'm glad Maxine had a great introduction about Berg. And so the Berg is really what we started in here, and it is actually started from ERG, the Employee Resource Group, but Northwell put it into a new concept, I would say, including the B as business impact, right, in there. So Berg is leveraged, so we are leveraging Berg members to not only provide this kind of diversity and inclusion, we also want to think more to create more business impact in there. So, you know, so this is whole thing combined together as a business employee resource group. And this is co-sponsored by HR and the Center for Equity of Care as Northwell Health. And we are not only concentrating on diversity, we also focusing a lot on the inclusion area. So that's the reason why we not only have diversity Berg, like the Bridges Berg, we have different segments. We also have Valor Berg, which is for military and the family there. We also have Enable Berg for our disability population. And then we also have Expression Berg, which is carrying our LGBTQIA and plus community. So, you know, all of those together build this kind of great program and build this Berg into a kind of family in here. And we truly understand that, you know, anyone cannot fight this kind of like mission by itself, by one segment. So we are working together as an ally, especially when, you know, earlier last year and through this year, I would say, anti-Asian hate crime in there is really, really a kind of peak. So we as Asian Berg, we are not really focusing on ourselves. We are looking to find other allies together. We need to fight this together. We need to provide educational to all different segments, to all different backgrounds, and letting more people understand what the real story is in there and how we're gonna make people understanding more about our diverse perspective, right? And so this is how we are working in here. And at each of the Berg, we have our 3 different charters. We're concentrating on community. We're working a lot of things on the community, workforce development, business impact in here. So for example, our Asian Berg, so we have a great leaders in the Asian Berg, and we have like Ariba is here today, and Amy was here. Yeah, Amy is here also today. So all great leaders for the Asian Berg, and Asian Berg has a great structure to, as a kind of system, is a great vehicle to moving things on and moving things forward. And, you know, we provided a lot of like workforce development programs, like professional development workshop for our employees. And, you know, always we're not really concentrating on Asian Berg members. We open it up to all employees. We want to create a more inclusive environment in there. So, you know, we provide a lot of programs to our members and also our employees. And we want to let people know this is a place where they can seek some support. They can find the belongings in here.
Thank you so much, Chandler. And speaking of belonging and inclusion of people, one group that's often left out, and there are 3 people on the panel right now who are belonging to this group, that's the immigrant group. And we take so much pride in being immigrants. And so I'd like to have Aditi answer this question. Can you tell us some of the ways that immigrant employees can be discriminated against, and what DEI initiatives can help reduce the discrimination and biases that are faced by this population of employees?
Yeah, absolutely. Thank you, Maya, for this great. I'm very grateful for this opportunity. So yeah, like Chandler highlighted, right? There are so many invisible barriers that Asian Americans face, right? Similarly, immigrants are a forgotten minority, and there are a lot of barriers that they face that employers are not really aware of. So, if you think about visa processes that we have for immigrants, um, there are so many nuances, right? Even an immigrant from India versus an immigrant from China would experience different forms of discrimination. So if we tie all the groups together and ignore the nuances, we will not be able to overcome the barriers actually. So it's very important to look at them individually. And when it comes to, overall immigrants, how they, what kind of barriers or biases they face in the workplace. One example is, during the visa process, there's a lack of awareness and general veil of hesitation, right, in speaking openly and learning about, these issues among organizations, employers, and this takes a toll on an immigrant's mental health, right? And that's definitely something that, is not really covered or not really well known. There isn't a lot of awareness about this in organizations. And when it comes to discrimination, I know about a lot of friends and colleagues who require a sponsorship from their employers to stay in this country. And because the employers know that, they exploit them by underpaying them or by overworking them because they know that they cannot leave that easily. Now, the Great Resignation has turned things around a little bit because employees do have the option, right? They have the job mobility and they have the courage to negotiate and leave. But in terms of DEI and A initiatives, I think it's very, very important to increase awareness, right? Immigrants are forgotten minorities. They should not be forgotten. So it's definitely something where employers should take the effort or should make the effort to understand what barriers the immigrants are going through because they are minorities as well.
Thank you so much, Aditi. And that is so true that we are minorities as well. And I just want to highlight that immigrants were definitely at the forefront of the COVID-19 pandemic, whether that be in the area of frontline workers like physicians and nurses, or if that was in essential workers such as grocery individuals, delivery individuals, immigrant workers were definitely at the forefront. And as mentioned in healthcare workers, I want to switch this question to Maxine to tell us a little bit more about how in the era of Great Resignation, what strategies can healthcare institutions implement to reduce turnover among BIPOC employees?
Yeah, I think, and I welcome others to weigh in on this. I think, oftentimes when we're asked in the era of the Great Resignation, our turnover hasn't gone up that high. And I, always say we're not starting now. We've been at this for a very long time. And if it, not that we're perfect, but I think our culture and our infrastructure has helped us to kind of weather it a little bit better than others. And when we talk about our culture, it's everything related to our values. We're actually refreshing our Northwell values right now. And in its next iteration, members of the team are familiar. We've got values like truly compassionate, truly innovative. In its next iteration, truly inclusive will be appearing, right? And it's just signaling to the organization and to anyone that we're trying to attract or retain that we have whole commitment to that. So now there's truly inclusive as a value. Well, how do we live it? And so you'll see this expression, how it's lived by leaders, how it's lived by all team members, and how we evaluate performance, how we evaluate compensation, right? All of that, how we recognize, all linked together. So I think culture is first, right? And the investment in culture to everything that's been said about belonging. Part of culture too is listening. So, once again, a nod to our team members, we can sit in a room and devise solutions that really haven't been calibrated and tested and meet the needs of our team members. So we understand, and I'm looking at Aditi on people research, we have to start with listening. So we've got to have conversations. And so we do a lot of surveying at Northwell. We do focus groups through our Bergs. We do a lot of listening sessions because we want to understand what are your needs, why are you leaving? And we are doing stay interviews, Allison. We've formed a retention task force that's focused on the roles where we're seeing the highest turnover, and stay interviews are happening both electronically and then live in person. And we've always done stay interviews, but it's definitely more robust right now. So I think the listening piece is critically important. Knowing who they are and where they are, right? So the data. At Northwell, historically, we didn't have a diversity dashboard until about 3 years ago. I came into the deputy role and I asked our teams, we needed, to create a diversity dashboard. And now we've got one in our new system as well. And it's definitely more real time, because we've got to actually see what's going on and validate our perspectives or suspicions, if you will, to help understand. So listening, knowing, learning and education, team members knowing, we know that oftentimes why people leave, it's lack of career, certainly you leave your manager, we've all heard that, but more and more we're hearing lack of investment in my learning and in my development. And so huge investment, has to happen there. Connectedness with, once you know who they are we reaching out and connecting with, that's also important. Pay equity, fair compensation, market competitive compensation, all of those hygiene factors remain always critically important. Are we paying a living wage? Are we looking at what I call social determinants of employment? Those barriers to employment. Is it childcare? We did an engagement survey, in our last engagement survey, over 70% of our team members said they had caregiving responsibilities, the vast majority people of color. So are we supporting from an elder care standpoint, from a child care standpoint, living wage, affordable housing? What's our advocacy there? How are we supporting that? So I think it's a whole host of factors. And we know this because, again, we've listened to our team members and we've studied the data. And so that's what we would advise employers. And we're certainly often asked to advise other employers on this. And these are just some of the features that we highlight.
So I have a two-part question from the Facebook live chat that I picked up. So the question comes from one of our regular listeners. They would like to know is, first of all, what is the definition of truly inclusive? And second of all, what exactly is a diversity dashboard?
Yeah, so great question. So previously at Northwell, we knew, for example, that 72% of our population is female. We knew that. We knew what percentage is African-American, Asian, but the intersectionality piece, the overlaying of data. So fine, we know those broad numbers, but what percentage, let's say, is Black male and being promoted? Asian female leaving, participating in career development programs, right? So we start to look at all of those, let's say in the team member life cycle, from attraction to engagement to departure, what's happening, who's it happening to? And the dashboard seeks to give us all of those insights. And we evolve it over time. The team sometimes gets annoyed with me. I'm like, what about this? Add that in, throw this in. I want to know union. I want to know non-union. I want to know generation on top of race, on top of gender, right? So the dashboard is just, it's a data drop, if you will, that allows us to have those insights. When we talk about inclusion, and so everyone knows this, the definition of diversity, and Kemi, please jump in. You are the expert here on this. But we know, put simply, we're referring to differences. If I had to boil it down, distill it down to one word. Belonging, we know, is how I feel, right? Do I feel welcome? Do I feel invited? Do I feel like I belong here, put simply? When we talk about inclusion, what are the practices in the organization, in essence, to include people? I mean, we overcomplicate a lot of these definitions, and certainly Northwell has huge definitions on this that we teach, but just distilling it down. How are we showing team members that they truly are included in our decision-making, where it matters? They're part of the conversation. They have a voice. I always say it's not enough to have a seat at the table. They have a voice at the table, and we invite that voice at the table. So those are just some of the examples. I've tried to put it, again, as plainly as possible, and others please weigh in.
I love all of what you said, Maxine. I would just add, when I think of inclusion, I think of a lot of the work that we do with communities on the ground, and we are not doing things to people, we're doing things with people.
Right, that's right.
And so that's what I would just add to that, but I loved everything else that you said.
It's the width.
On point.
Exactly.
Mhm.
It's the width.
Thank you
Great
so much.
question.
And I just want
Sorry, Maya, I was just saying great questions. Thank you.
yeah, it's a great question. And I just want to say that I talk, but we're one. So if we could just piggyback of each other and just, just have a conversation about diversity and inclusion, have a conversation about the Great Resignation, instead of answering the question specifically, because I want to give everybody an opportunity to talk, but I'm seeing that we won't have enough time to do that. So just if I could pick your brain, like, what do you think, what factors you guys in the Great Resignation, and everybody about means the organizations being a little bit more inclusive, especially looking at the concept of intersectionality, which is often overlooked. So Three Red, anybody just can start talking, including Dr. Myers, because she's moving also into that role. So she could also jump into the conversation.
I couldn't hear the entire questions properly because you were going in and out, but what I got from your question is, what can organizations do to create foster a more inclusive environment? And I'm jumping in because I wanted to add something to what Maxine said. I echo everything that she said, and you made wonderful, great points. Yeah, to your listening part, I totally agree. And I think that's so important. That's the first step, right? Increasing awareness, listening to employees. Just wanted to add to that, a lot of times, listening, it can come in a lot of forms, right? In order for you to listen, right, you have to give employees more visibility and a platform to share and speak up, right? And also to make sure that if they share, there are no retaliations. So even giving anonymous channels for them to really speak up and be open about what they are feeling and what would help them, right? So asking them directly. And once they tell you what they want and how they are feeling, do something about it and show them that you are doing something about it. Because a lot of times what happens is employees speak up, right? They share what they're feeling. Employers listen, but then if nothing happens, it discourages them from sharing again. So it's extremely important that leaders take the action and show the employees what they are doing to bring a difference in the environment. So just wanted to add that piece, because a lot of times conversations can become fluffy, right? Employees can talk to their managers and be like, you're doing great, you're wonderful, but that's actually not what's happening. So I think anonymous channels are highly encouraged.
Anybody else? I think that's very important. And I just want to touch also on, earlier we spoke about the piece about belonging, and belonging ties into listening. How can we make people feel like they belong to an organization? Because oftentimes, especially, I'll not use an organization, I'll just use like healthcare, for example, that sometimes it's very white. And so how can, and people get lost in, especially Black women. And I'm saying that not only because I'm a Black woman, but in Mackenzie's Woman at Work that just came up recently, we could see that women, and sorry, Chandler, I know that you're the only man here, but women are making so many strides, but yet still women of color are being left behind. So how can we be more inclusive of that? How can we show women of color that they belong? And Chandler, as an advocate and feminist, please put in your male perspective as well.
So it's so funny. I think I have been into several talks. I'm the only male supporting or being in the conversation. I always think that me and there's a lot of male we are really supporting on this issue, right? This is part of allyship. And this is part of, we need to work together to build this kind of like great pictures in there. And we see this kind of things, especially in the healthcare, as you mentioned, yes, it's happening. How we can support, even though for me, like a diverse male, we sometimes, even like I can say Asian male is really, really rare. You can see in the leadership role in the health system. So, even though we are facing a lot of challenges, but we are willing to work with every other people over here. We're fighting this together, right? And for your first question, first part, like for the belongings, I think there are several things we can say in here from the Berg perspective, right? We know there's people from different areas, there are different background, so we try to celebrate as much as festivals as we can from culture background. Right. So, for example, we have every year Lunar New Year is the biggest celebration for the Asian Berg, and then we celebrating Diwali, and we celebrating Filipino American History Month. There are so many other celebrations we have for the Asian Berg and also for the whole diverse Bridges Berg. On the other side, I want to mention, because I was at Feinstein, and by that time, Feinstein is a research institution for Northwell, and I was the culture of care facilitator at Feinstein. So Feinstein, because of research perspective, we have so many researchers from all over the world coming into Feinstein building. When we do the culture of care, at the very beginning, how we break the ice, we're asking people to introduce themselves in their preferred languages. So you will see in one session, we have maybe 8 or 10 different languages being spoken in the room, like with 20 people over there. It's so fascinating when we see people from different countries, they have totally different background, speaking different languages over there. So that point make people feel belongings over here. And then if you hear someone saying the same language you say over here, you feel like a kind of connections in there. So those are kind of like great things in here. We build this kind of belongings to people.
I love that, Chandler, and you actually made me think about, and going back to Dr. Williams' question, as a Black woman, I actually was asked to take on a role in technology. And so if you think about the profile of technology in terms of the stereotypical folks that would be in that space, it used to be very similar to what you just said. I think it's gotten different over time. But I was chief technology officer. And so the one thing I would say to answer your question, based on my experience, is the term imposter syndrome just automatically comes to my head. And so for folks on the line, imposter syndrome is I felt like an imposter in that role because I felt like I didn't belong. How in the world was I chief technology officer in a multi-billion-dollar organization, not having a deep computer science engineering background? And so I had to give myself a pep talk and knock the inner critic off of my head to remind myself, well, I'm here for a reason. So like really honing into like, what is your leadership purpose in the moment? And why am I here doing this job? And then finding, to Chandler's point, finding the commonalities with people that might not look like me. I had 3 kids, so I always talk about, we have to find the helpers. So finding the helpers and the commonalities, like what is our common mission? Because sometimes we have bias. I had bias coming into tech. I have to just check myself in terms of coming into that space. Like, why do I feel like I don't belong? If people are looking, people will always look for ways not to belong. And I'm inviting people on the phone to look for ways to belong and just kick that imposter syndrome off the ledge, because otherwise it will eat you out from the inside out, and it will not be, you will not show up as your best authentic self. And I can tell you, as CTO of that organization, 95% unionized, by the way, that was like one of my best jobs ever. But it took me a lot of time to really, to Dr. Williams' point, to really feel like I belonged. And I had to like really train my bias in my brain to stop the cycle. And that's hard. It's not easy.
Um,
Does Maxine or Aditi have anything that they want to add? Because imposter syndrome is such an important conversation to have. So I would like to hear what you guys have, if anything that you guys would like to add.
yeah, Maxine, I know you unmuted yourself. You can go first. Okay, just wanted to add to what Kemi said, I think as for organizations, it's so important because women or women of color, they have imposter syndrome, and a lot of people do, but since we're talking about, women of color, it's so important, for people like Kemi, right, in organizations to share their stories and organizations to, encourage them and show them, give them role models, sponsorship, mentorship, right, to really empower women, right, rather than having or asking women to, lean in or do things on their own, right? We need role models, we need people, right, who can encourage us and show us that there is a path for you, right? And organizations need to encourage women in leadership roles. So just wanted to add to that.
Yeah, I'm listening to both of you, and I think I agree with both. I think it's both. It's the individual. The individual has to have a commitment to growth and investment in self, right? And so there's a lot of, you've got to keep working on that as well, just becoming more self-aware, making certain commitments, engaging in certain practices where you increase the strength of your voice, right, and your presence through that. And then, yeah, there's organizational commitment. When we talked about the listening earlier, through our engagement surveys, and even when we've done surveys related to perceptions of bias and our commitment to diversity and belonging, as we were talking about earlier, what we hear is team members describing having to wear the mask, not being able to completely be themselves. We've had situations with team members who, were told, made comments about hair was made. And we had to educate regarding not only our own commitment and our culture and sense of belonging and commitment to belonging, but also the law, right? And so a lot of what we have heard from our team members, definitely through the anonymous channels and also the live, present, in-person channels where people have felt psychologically safe enough to share, that's informed so much of our practices in education. So I do think it's absolutely both. For sure. I'll share just really quickly. Someone said to me yesterday that someone had commented and said, she got that job because she's Black. You know that, right? And I said, wow, if I had known that, I wouldn't have worked this hard all these years. I wouldn't have been here before sun up, and I wouldn't have been here after sunset. I would have just sat there and waited for someone to notice that I was Black and make me the head of HR for, a $13 billion organization. That's what I would have done. And we go up against that as well. And oftentimes it comes from people who look like us, right? And that's another conversation we should have another day. And so there's an internal fortitude you have to have and a strength you have to have that, to Kemi's point, I think you've got to keep investing in yourself as well, because without it, you won't be able to survive for sure and thrive, more importantly.
Thank you both. And I also want to add on to something Aditi said earlier about sponsorship. I think I wouldn't be where I am today in my career if it wasn't for sponsorship. And that's like sponsorship from people like Dr. Myers, who even when I was not in a room, they would mention my name. And so sometimes I tell people, especially as you develop for your career and especially as Black women, there might be a lot of people, there might not be a lot of us in like leadership positions, but if you could at least look for a sponsor, like Dr. Joanna Martinez is definitely a sponsor of mine. Like she would talk about me when I'm no longer in rooms. And so that's something that individuals should look for, as opposed to having mentorships, creating groups or just little groups where you could hang out and talk about career. That's something when individuals, especially since there are not so many of us, when there's somebody who, if you're afforded a seat at the table, then you make space for somebody else. And there's also another where I believe it was Tyler Perry who said that if you're not given a seat at the table, then create your own table. There are so many things, even though, at the end of the day, it's very hard. It's a very hard and sometimes a lonely road. But I think sometimes finding community, and there are people who could help us. And there is research out there that says that in terms of mentoring, like sometimes having a Black woman, especially a Black woman who is young in her career, with a white man or maybe an Asian man who is in a leadership position, then that could definitely help the Black woman to get visibility, or the woman of color, whichever it is. And any last thoughts that any of you guys have before we hand it over to Dr. Myers to close off?
Okay, so Maya, I think I just want to make one comment in here, because I think some of us, we have the common background as immigrant students, right, coming over here. So I just want to mention that, you know, as Maxine mentioned, like if we know that this is something like I would say political right thing to put that diverse or people in color into some kind of role, right? So some people have this kind of like false statement over there. So, you know, for us, like we need to definitely, firstly, I think, working hard by ourselves to making our reputation, making our, like, prepare ourselves to accept any kind of challenges in your workplace, right? So I think for me, right, and for others who graduate from the like university or any graduate school as immigrants, you know, when they prepare in the future, they need to take small steps over there, right, and prepare, and using every single opportunities, take all the small opportunities in there to accumulate yourself, to prepare for the future, right? And then I think sometimes finding some great mentors throughout your career path is really important, and those mentors will really guide you in the future if you need to make any decisions, and help you a lot of things in your decision making in there. And you know, for me, I think I just want to, the last point I want to say is really be confident, because, you know, most of them, English is not our first language. And for me, when I was first started the job at Northwell, I think Amy can say that, you know, from a few years ago, I'm not that confident to speak out. I'm not that confident to speak in front of people. I can now imagine if you put me in this kind of situation when I first start my role at IRB, I'm gonna be so nervous. I cannot complete one sentence over here. But you know, you should be proud to have the English as your second language. And you know, this is something I feel so honored. I feel so proud. Like I can speak 2 languages in here, and I can process in 2 different ways, right? So, but being proud and being brave to practice your English skill, practice your language skills in there is really important for yourself, right? So by the end, it will all paid out. And then have a good face in there and be sincere all the time, and know that, you know, treat people sincerely, and you know, do what you need to do, and people will get back to you, and you will have a much better situation in the future, I think.
Thank you so much, Chandler. That was well said. And I think tonight's panel was really great. All 4 of you are wonderful, and we hit on a lot of great things. So first of all, there's allyship. So especially when you're outside of the realm of being a person of color, a female, someone with a disability, someone who's a member of the LGBTQIA community, we need you to be allies, because a lot of us are dealing with multiple different issues, especially this whole concept of intersectionality, which was first created by Dr. Kimberly Crenshaw around Black women, but we know it goes beyond that. And I think one of the examples I can think of is one of my colleagues who is a gay man, white male, came to me because one of his mentees is a Black queer woman. So we were saying that I can help her, but so much, because as a Black heterosexual woman, I can't understand or help her with some of the things that she may deal with as a Black queer woman. He, as a white gay male, could help her with some of the, you know, her sexual things that may come up in terms of sexuality discrimination. So it was kind of one of those things where, going back to, I think that point Maya made, is sometimes your mentor may not necessarily look like you to be able to open doors. And I think also it's important to distinguish between mentorship and sponsorship, because they're not one and the same. So me sponsoring Maya is putting Maya out there and kicking her butt when she has that imposter syndrome, and being like, you know what, I'm busy right now, I can't review this article, but I know a wonderful PhD who can do it for me. And I just did that to her 2 weeks ago. So this is real. This is not me just making it up. And that's what we have to do for people. We have to look out. I have a young lady that at the next institution that I'm going to, she was like, I really want to build my resume, it look like yours. So I sent her something today. I said, this is a program that I did to get young people of color into research. You should apply for it. So that's what sponsorship is, as opposed to mentorship. And it's really important that we have both of these, as well as job coaching. Job coaching was something I never knew about until I was a part of a program through the NIDDK, and that has opened my eyes and changed my life. And I think until you're in a situation where you have leadership that is trying to grow you, you're not going to be aware of all these different things. And for me, that was part of the reason why I felt the need to move on, because I said, you know what, after I got all this training, man, this imposter syndrome hat has to come off. I need to grow. And I think that once you get that, then you're able to move on and you don't feel stuck. And then you can give back to other people of color, other women, other people in the other marginalized communities, immigrants, to help them to be able to grow just the same. And it's really important to pay it back, because the seat at the table, there's not that many of us with chairs, but when we get there, it's really important that we bring other people so that we can all eat. Because the more diverse a company is, the more diverse corporations are, the better outcomes you'll have. You'll have better employee satisfaction, you'll have better health outcomes. We know that numerous studies have shown it. So it's just, this is something where we need to see more diversity at the top than at the bottom. And I remember one day talking to my dad, he worked in business, and he said to me, you have to remember, diversity for you as someone as a marginalized person is not the same for other people. You could have a white man who's Italian, a white man who's Irish, and a white man who's gay, and that's technically diversity. You may not see it through that lens as a Black woman, but someone else could see it through that lens. So when we use this word diversity, we have to remember it's like a kaleidoscope. I may see it one way, Maya may see it another way, Maxine, Chandler, or DT Kemi. But at the end of the day, we know that diversity means that everyone should look somewhat different and come from different backgrounds. And that's what makes this country so great, because we should have so much diversity. Thank you all again. Dr. Williams, it's been real. And I wish everyone a wonderful, happy, healthy holiday season. If you haven't gotten vaccinated, please get vaccinated, get your booster, because Omicron variant, although it may be milder, so they're saying, it looks like it's more contagious than Delta. So make sure that you take care of yourself during this holiday season, stay safe, wear your mask, wash your hands. And that's all I have left.
Thank you, everyone. Happy holidays.
Thank you. You too. Be well.
Thank you all.